drinks if you need any of those. Housekeeping also, if you haven't been here before and you walk out the back door to your right are restrooms if you need them. Welcome. Thank you all for being here. My name is Joe Toolan. I'm the chair of Annapolis Pride. I use he, him pronouns. Really excited to be here tonight to tackle a pretty important topic in our community, which is mental health, physical safety for LGBTQIA+ youth and families. And so we're really glad that everybody's here. This panel in particular is possible because we received 2 grants in the last year, one from the city of Annapolis and one from Arundel County, to do panels like this. So thank you to both the city and Arundel County for allowing us to do this. And it is being recorded, so if there are folks that aren't here tonight, we'll get this posted and share the recording with those folks as well. I'm just going to be really quick. I wanted to thank all of our panelists for being here tonight. And our moderator, Jazzmyn, who also was previously on our board. So thank you all for being here. I also just wanted to take a moment and recognize that we do have a couple of folks that are running for Board of Ed or for congressional districts who are here. So if you want to raise your hand, if you're running for any of those, that would be great. Thank you all for being here. We are technically a nonpartisan organization, so I can't endorse anyone in particular, but it says a lot that they're here in the room looking to learn about the issues impacting our community. And so after this event is over, I encourage you to go see the people that raised their hand and talk to them a little bit, because it's really important that we know that whoever is being elected for any office, whether that's at the local level or at a larger level, that they're keeping the impacts of our community in mind in their work. So with that, I will turn it over to our vice chair, Katie, who has a couple of other opening remarks to share.
Thank you, Joe. I'm going to show him. Good evening, and thank you for joining us for a discussion on health and safety for LGBTQ youth. I'm Katie Connolly, Vice Chair for Annapolis Pride, and my pronouns are they, them. Before we get started, I'd like to recognize some of our board members and staff who are here tonight. Could they please stand? These folks work tirelessly on our efforts, and I'm grateful for them and honored to work with them. Tonight, we will dive into the topics of mental health, physical health, and physical safety for LGBTQ+ youth, and we will have time at the end of discussion for questions. According to the 2021 Maryland High School Youth Risk Behavior Survey, nearly 1 in 4 high school students in Maryland identify their sexual orientation as either gay, lesbian, bisexual, or questioning. 1 in 4. Wow. That is a significant population. In September of 23, the Maryland Commission on LGBTQIA+ Affairs published their recommendations for supporting LGBTQIA+ students in Maryland's K-12 schools. In it, they state, Maryland's K-12 schools are often unsafe, hostile places for LGBTQIA+ students. LGBTQIA+ students are experiencing high levels of bullying, harassment, assault, and discrimination in our schools. The violence comes from multiple directions, including fellow students, teachers, administrators, family members, and other adults. The effects are dire. LGBTQIA+ students who are victimized in schools suffer lower GPAs, lower school attendance, and lower post-secondary aspirations. The damage is not limited to school achievement. Anti-LGBTQIA+ hostility in school also leads to severely impacted overall health and wellness. According to Liason National School Climate Survey, LGBTQIA+ youth who are victimized in school suffer higher rates of depression, lower self-esteem, and higher rates of suicidal ideation. This is heartbreaking and unacceptable. If there is anyone here tonight feeling this way, please know you are loved, you are valued, and I promise you it gets better. I know what you're going through. Many folks in this room know what you're going through. It may seem dark now, but I promise you it gets better. You will find your people and you will rediscover the beauty of life. I want to pause and quickly tell a quick story. This morning, as I was reading these words to my wife, as I do anything I write, our youngest was climbing all over me, grabbed my face, started looking into his eyes, forehead to forehead, smiling and laughing. And my wife says to me, you know, I need you to take a minute here and reflect on the words that you just said. Be present, be in the moment. And I'm so glad that she did. Because there was a time where I didn't think I'd be here. I didn't think I'd be married. I didn't think I'd have a family, be successful, be vice chair of an amazing organization, and I am. I have all of that and more. So when I say I get it, I get it. I truly get it. Keep fighting. It gets so much better. To the parents, we thank you for showing up. Parenting is challenging, rewarding, all in this beautifulness, right? It's not always easy, but showing up is necessary. Thank you all for being here. Our moderator tonight is Jazzmyn Proctor, pronouns she, her. She's a rising counselor in Maryland. She previously worked for the Housing Authority of Annapolis and has worked as a case manager in various settings. Jazzmyn has worked with people of diverse backgrounds and is currently researching the impacts of religious trauma on marginalized communities. She'll be opening up her own therapy practice in early September. Now to our panelists. In the middle, Smith Broadwell, pronouns they, them. A psychotherapist in Annapolis and owner of Tonii Gedin Wellness, a therapy practice committed to affirming mental health services for children, adolescents, and adults. They studied studio art and psychology at Washington College in Chestertown and completed their master's degree in divinity and social work at Boston University, specializing in religion and conflict transformation and social work groups. Dr. Tonii Gedin, pronouns she, her, joined the Arundel County Department of Health in May of 2020 and was appointed as health officer in July of 23. She worked in Baltimore City for 10 years with federally qualified health centers, Baltimore medical systems, and Health for the Homeless as the chief quality officer. She believes the healthcare system must fundamentally change to meet people where they are and remove barriers to care. Captain Amy Miguez, pronouns she, her, is a captain with the Annapolis Police Department. She's working on a master's degree in police leadership and administration with the University of Maryland, College Park. She currently oversees Community Outreach Division. Captain Miguez was named the department's first LGBTQIA+ liaison in 2018. All of our panelists are also members of Annapolis Pride's Advisory Committee. Thank you. Jazzmyn.
Thank you so much, Joe and Katie. It is so wonderful to be here this evening, and it's so wonderful to see the many faces that support such an important issue. At the Housing Authority, I worked as the youth education specialist, and there are so many stories that I carry of LGBTQIA youth within those communities who were not able to receive the support that they needed, and I was very honored to share a space for them. So without any hesitation, let's get started on our evening. So the first question is, for all of you, what motivated you all to be on this panel?
For me, I would say it's the same reason I became our first liaison. You know, when Jeremy Browning founded Annapolis Pride, he saw that as a stepping stone for Annapolis, for the police department to have that position named as a liaison with the community. And since we did yoga together, he thought of me, and I was happy when the chief agreed that I could do that. I see it as important to show the community that the police department sees them, that we're here for them, just like any other member of the community. And I'm happy to participate in whatever way I can to share information from the police department, to get information from the community. And that's really why I'm here.
Good evening, everyone. I think as health officer, one of the things I've talked a lot about is health equity and what that looks like and what it means. And for me, a lot of that is being in community with people, because otherwise, it's really easy for us to get into, oh, this is what I think people need, or this is what I think people are looking for, or here are the resources that we can provide. And participating in events like this are as helpful for me as they are, I hope, for you all, and learning and listening and being able to understand better what we can be doing as a health department to serve residents in Arundel County. But I also think that it's really important that we move the narrative forward, right? I think we have to be in spaces and understanding language and lived experience of people, because as a person who would like to consider themselves an ally, right, there's still a lot to learn. And I think this position on the board gives me an excellent opportunity to do that, but also to move us forward as a health department. And who are we partnering with? Who are we working with? Who has access to our services? And where are those gaps? And how do we continue to close them? And so I'm just excited to be here tonight and hope to learn a lot from you.
And for me, I am on this panel for me. I'm on this panel for family. I'm on this panel for me. I'm on this panel for my family. And I am here for youth and families that I work with. As a queer, trans, non-binary adult, I remember what it was like for me to be a young person who did not feel safe to be who I was. And I want so much different for my community, for young people that are coming up after me. I have young queer family members who I want to feel safe and supported. And beyond safety, I want them to feel freedom and agency and belonging, and I would like them to feel joyful nothingness as well. And then there's the treasures of people that I work with, queer youth and adults and their people in the context of early mental health therapy. Adults are great. Adolescents are my actual forever favorite brand of human. And I have seen firsthand what it can look like when queer youth have support. And when it comes from their families, that's huge. So I wanted to be on this panel to share what I have learned with people that I work with, and from the people who I have learned from coming up before me. So
Thank you all so much. As we sit here and explore different aspects of health and safety, the first thing that comes to mind is the amount of hiding that happens as LGBTQIA youth when we are not in environments that are affirming, when we have to protect ourselves, whether emotionally or physically. The sense of self is often distorted, and it takes an affirming community, it takes leaders, and it takes all of us together supporting them and letting them know that their voices matter. So my first question for the night is for Smith. As a therapist, you have worked with both LGBTQIA+ youth and their parents/families. How can parents foster safe spaces where their children feel comfortable sharing and opening up about their lives?
So I could say so much about this, how to encourage safe and open sharing at home. The one thing I'm also thinking is being here is huge. And in thinking about this, I would like to stick with a couple of things that come up the most when I'm working with parents and families. And it might sound simple, but I think that these are things that are at the core of anything that comes after these things. And the first thing is to believe them. Believe kids, believe youth when they tell you who they are. And hang in there is a rough period of time for any kid just because of their age developmentally. So with my thoughts around believing people, anyone, but specifically for tonight, I want to share a more personal reflection on what I have learned as a parent to younger kids and how that's come and met up with my experience as a trans person. So I do this thing when anytime my kids reach some milestone, at least what I feel is a milestone for my children, like learning to swim, or the night before their birthdays, I whip out my phone and I just get sucked into it, scrolling through old photos, looking at their little faces when they were fun, and thinking, just being stunned by the difference between what I experienced them as then and how I experience them now. What I know about them now, actually that I didn't know then. I feel like I look back at these little faces in my photos and my videos, and I can see so clearly, like, oh, at 3, this kid, I can see the complex likes and dislikes that I, as a parent then, I literally didn't know. And it's striking to me, it's stunning, and I feel almost like this need to review when they hit these big milestones. And I think it's what I'm after is the reminder that I never fully know my kids. I think this applies to humans. We never fully know one another. There's always more to know. And so something I started to say to my kids, hopefully I don't say it too much, I tell them, I'm so glad to know more of you. And I don't say this because I've like learned it in some like parenting book somewhere. It's because I know what it felt like to tell people about myself and be able to see that it didn't land. It didn't make sense to them with how they'd always known me. And I've seen what it looks like when somebody maybe doesn't believe what you're saying about who you are. So I would say, no matter what you've always known about your kid, what you've always seen of them, believe them when they tell you about how they feel, about who they are. Believing your child teaches them to trust themselves. And if they have a sense about how they feel, about what kids at school make them nervous in that like scary but exciting way, how they want to wear their hair, what pronouns they want to use, maybe that you've never heard before, or at least never tried, believe them. I think that everything comes back to this when we believe kids. It changes what we do. And then the other thing is just some encouragement that if you just hang in there, you'll get through this phase of adolescence. And I know that's a really big one. It starts early, it goes a long time. In the preteen and early teen years, there's a developmental leap that happens, and our brains become more complex, and all of a sudden, the thoughts are more nuanced, and we understand more of the world, and no longer can parents just look at your face and be like, well, you're hungry. Or that little twitch you just made with your eyes, I can tell you're uncomfortable and you would like to leave the room now. Those are things that need to get unpacked through conversation. And in those early teen years, we don't come with a natural ability to just put new words to the feelings and the thoughts. And so just hang in there. Learn from your kids, learn for your kids so they don't have to do all the teaching for you. Get involved with people that fit you and your kids into queer spaces, witness what it's like for them in queer spaces, and start pronoun study groups with you and your friends. Get with people who can help you practice as much as possible. So experience and learn again there.
Thank you so much for your thoughtful answer, Smith. And something you described just so eloquently is being open to listening to their lived experiences. I mean, we can watch media, we can read books, we can read articles, but nothing beats being able to be present with someone's lived experience and being able to hear what it is like for them so that we can learn how to best support them. So thank you. The next question is for Dr. Gedin. Can you discuss some of the needs or challenges in supporting LGBTQIA plus youth in the county?
Absolutely. So one of the things I wanted to start with is we often get questions because we, as a health department, put out a lot of data, right? Here are some health indicators, outcomes for the county. And when we are disaggregating that data, we often are not disaggregating it by sexual orientation or gender identity. And so I get a lot of questions as to, well, why is that? And there's a couple different reasons behind it. One is the data sources that we're using may or may not collect it. And if it is collected, is it collected uniformly? And that is definitely a challenge. So when people say, well, what does the health care look like for this population in the county? It's difficult to answer. And so that leaves us with, again, lived experience, being in conversation with people, understanding what the needs are, and trying to kind of piece different data together that may not be specific to Anne Arundel County, but saying, okay, we know, for instance, that the rate of smoking in the LGBTQIA community is much higher, right? So that's one thing that we look at and we say, okay, nationally, I don't think Maryland's probably any different. So how do we advocate for more resources and push that forward? We know that there are a number of areas where those gaps kind of leave us to question, okay, what should we be doing and where are those gaps? I think there are a couple of things that we want to focus on. Understanding various populations. When we're looking at people experiencing homelessness, right? We know youth in this community, depending on what they're dealing with at home, are more likely to experience homelessness. What are the services that we're offering? So for us, it's making sure that we're going into shelters, talking to folks, providing services where people are, in addition to things like our substance use services. What does that look like? How are we providing services in a number of different areas, as well as our sexual health services? How do we get those out there? We have various low barrier ways that we like to make sure that people are getting information. I think that sexual health is an area where we struggle a lot to get education out there, right? Regardless of the community, but even more so in this community, we're making sure that people really understand what risks are, how to protect themselves, how they should be interacting with other people. I think we have a lot of work to do in those spaces. Also providers, right? This is not one that I think we talk about as much as we should, but how providers are interacting, asking questions, how are they responding when people say something, as Smith just mentioned, maybe it's not language that you're used to. What is the response that you get, right? If someone answers their gender identity with a response that you're not prepared for, you've never heard before, what do you do then? Even small things like electronic health records. Are they equipped to, there's a lot of drop downs, and you'll see your providers doing this like the whole time you're in there. They have to come a long way to make sure that we're actually capturing people's pronouns, and insurance is another tricky area. And I don't think as a healthcare community, we're where we need to be to provide inclusive services and to make people feel comfortable. I think we have a long way to go. It's hard to find providers. If you're looking for providers that may identify as gay or transgender, how do you even find those individuals? It's super hard to do if that's what you are looking for and that's what you're more comfortable with. And so I think for us as a healthcare community, we've got a lot of work to do, and there are some resources and clinics and specific organizations that do a lot of work in this space to make sure that they are being inclusive and making people feel comfortable. But I think we have a long way to go, and particularly in the mental health space. as well. We just don't have enough resources for youth, and that's across the board. Every group that I talk to of parents is looking for easily accessible, low barrier resources for youth, and it's hard. They're waiting lists. We have a clinic at the health department. It's called Adolescent and Family Services. Unfortunately, we have a wait list too. And we're adding language, for instance, if you're looking for a bilingual therapist, the wait list is even longer for things like that. So it really just depends on which area of healthcare we're looking at, but there are a number of challenges, I think, in making sure that we're appropriately supporting communities, and I don't think we're there yet.
Thank you so much for your answer. You know, as she was talking, I was thinking about, when we think about barriers and homelessness, we think about intersectionality that comes with being a part of the LGBTQIA plus community, and acknowledging that while all of us have been able to get here, whether we had the day off or we were able to transport here, there are individuals who maybe don't have the transportation who are working right now, especially our LGBTQIA folks of other identities, of people of color, as well as different abilities who weren't able to get here. So it's also important within these spaces to amplify their voices as well, and make sure that they're also given the space to be heard and to be advocated for in this space. Next question is for Captain Miguez. Can you share resources that are available if someone is having a mental health crisis?
Sure, there's a number of resources that are out there both nationally and locally. I don't know, my mic keeps cutting out, I'm sorry. And mental health crisis is such a wide-ranging term. You know, when you're talking about on the more minor end of that, there's a number of national hotlines that are available for kids that are specifically LGBTQ related. There are people that you know are going to be literate in your community. Literate in your community, and you can find many things online. A lot of kids, you know, they don't want to get on the phone with somebody, so there's also a lot of online chat groups, legitimate ones that are with trained people, the Trevor Project, and there's a number of other ones that you can find as well. PFLAG is a great resource. They have a very curated resource page on their website. So there's a number of national resources on there that you can find. But locally, we do have the Crisis Response Warm Line. They like to call it a warm line so that you don't feel bad about calling it, because it's not a hotline. They want you to call, even if you feel a little bit off. That number is on, I brought a number of pamphlets that are on the back table. The Crisis Response Warm Line is 410-768-5522. And there are people there that answer 24 hours a day. Again, they deal with a lot of different communities. They have a lot of training that they do. They cover all aspects of the community, but they're not specifically LGBTQ group. So other places you can go, if you have someone in your life that you think needs a little more help than they're getting, you know, talking to your parents, their parents, a trusted adult. This goes to the believing part as well. When your kid comes to you with that request that they want to talk to somebody, it's important for you not to make those assumptions that you know your kid and you know what they're thinking and you know what they might do, how they behave, how they feel. Let them talk to somebody. Let them talk to somebody else. You know, if you have that ability to get them into counseling, which again, there's barriers to that as well, let them do that. Don't make the assumption that you know your kid better than you do. So, parents, trusted adults, there's teachers at school, I know, that become trusted ears for kids. There's school counselors. These are all people to go to. And if the first person you talk to doesn't help you, keep asking. Keep finding somebody to talk to. If they already have a therapist, you know, reach out to the therapist and tell them what you're seeing. You know, they're not going to discuss anything that they shouldn't, of course, but I'm sure they would be happy to get the information that you're providing. As far as a serious crisis where safety is concerned, all of our officers are mental health first aid trained, at the very least. That's the very least training that they receive. And we receive that initially, and then we have retraining. I believe it's every 2 years we have to receive that training again. But a number of our officers, a good many of them, also go through crisis intervention training, which is a week-long course, and they can correspond with trained counselors when we get emergency calls. The county crisis system has been around as long as I've been an officer. You're very lucky in the county. You have had co-responding counselors with police officers for over 20 years. It's not perfect. Our mental health system is far from perfect, but we try, and we're getting better. So don't hesitate, if you need to, for someone's safety, to call 911 and have someone come out. It can be a really scary prospect to do that, but what's scarier is if you don't make the call and something happens. It really is important to take these things seriously. I know that nationwide, it's such a big problem within the LGBTQ plus community in youth. Even locally, there's just some very sad situations where children experiencing mental health crises just weren't helped in time. So I just urge anyone, if you are feeling in any way that you would hurt yourself, you need to talk to somebody, and then somebody needs to try and get you help.
Thank you. And Dr. Gedin, Anne Arundel County also has many resources available to residents. Can you share about those resources?
And then Captain Miguez just covered a good portion of them, but looking at mental health resources, and so what's available, and there's a few different places that I would really recommend attending. As you mentioned in my bio, I spent about 10 years working in federally qualified health centers in Baltimore City. And I don't think people always know what FQHCs for short as an acronym, what they do and how they can help folks. And one of the best things about federally qualified health centers is they often offer wraparound services, right? So it's not just your medical provider, but they also offer things like behavioral health services and outreach services and social work in various forms. And so when you're thinking about what's available here in Anne Arundel County, there are 3 federally qualified health centers. Bay Community Health, which is kind of in the southern part of the county, Total Health Care, which is in Overton, but Chase Brexton is a spectacular resource, and they've been doing this work for many, many years. Much of it centered around the LGBTQ community and what that looks like. And they have a location in Anne Arundel County. So if you're looking for gender-affirming care, if you're looking for behavioral health care, they're an excellent resource. And they do, again, provide kind of end-to-end services. The other wonderful thing about federally qualified health centers is they will see you regardless of your ability to pay, right? So the whole purpose of FQHCs is to serve underinsured and uninsured individuals. So they will, if you're fully insured with great insurance, they'll see you as well. Glad to have you. But if you're unable to pay or if you're uninsured, they can see you. And so it's a resource for the whole community, looking specifically into undocumented communities and other populations that are able to see all of those individuals. But they also do just fantastic work, and they have been, and they've been working in this space for a really long time, and they're wonderful partners. There are other resources in the state, so if you're looking up a little further north into Hopkins, the Center for Transgender and Gender Expansive Health also exists, and then there are lots of resources if you're looking at the CDC's website and other places, but I would really recommend Chase Brexton if you're looking for a medical home and you're looking for inclusive whole person care. They do an excellent job. I have the pleasure of meeting with the federally qualified health centers in the county about once a quarter.
And they're always doing fantastic things. They have a Center for LGBTQ Health Equity. I don't know that too many other primary care providers are doing that, but they do, and they do really good work. And so it's just one of the resources I would mention, along with the online. I think it's fantastic. I think people have heard of 988 as a national resource. But you're really reaching out to any of them if you have someone who's really struggling. But as Smith said, when you're saying believe people, also believe them when they tell you that they're having a hard time, right? Ask some additional questions about what their plans are, if they have plans, and take that seriously. And I know that can be a really tough thing, and is a hard thing if you have to call for help for someone who doesn't want the help, but you think they need the help. How you come back from that and how you work through that trust is hard, but you want to have the opportunity to work through it, right? And so making sure that you do make those phone calls.
Thank you all so much. As we transition from talking about mental health into physical health, it's so important to acknowledge that both of those things are so interconnected. When our mental health is struggling, whether we're struggling with substance use, depression, anxiety, that can also impact our physical health, our ability to sleep, access to gender-affirming care. I mean, health insurance is extremely expensive, and so even the barriers that come with being able to have access to a primary care provider, having access to a therapist, or even having access to nutritional or health benefits that can support youth within this community, those two things are so closely together, which is why it's so important, again, when we have these resources, to share them, to publicize them to everyone that we know, and that we also support where we can. So as we transition into physical health, first question is for Smith. Access to gender-affirming care is one of the most important pieces of both physical and mental health. Please shed some light on what gender-affirming care looks like.
So gender-affirming care, really what it is, when you boil it down, is care that does not exclude who someone knows themselves to be, but rather affirms what they know about who they are. So more specifically, gender-affirming care, gender-affirming care can be a range of services, including medical, mental health, surgical, and social. Services for transgender and non-binary people. Steps in gender-affirming care for youth are determined with developmental appropriateness in consultation between doctors, clinicians, youth, and their families. So social care is often our first or primary affirming care step for trans and non-binary youth. This can include wearing different clothing, changing or experimenting with different names or pronouns, introducing themselves with new identifying language socially. And a lot of this experimentation, there can be a lot of play to it, and so it can mean that there's a lot of rotating of what's being tried. And then there can either be more changes that are expressive, and also some changes that are mostly like seeking comfort. So I think we often think about expression, and it's not always about the steps that people take to show who they are, but also to feel more comfortable within themselves. Then we have affirming medical care, which can postpone physical changes, as well as lead to physical changes that affirm a kid's gender identity. Interventions could be medication to stop menstruation, hormone blockers to halt the progression of puberty, and hormone therapy to shift hormonal development toward the use of gender. Legal care would come in when kids want to or are ready to legally change their names and more than just marker on legal documentation. And then there's also gender-affirming mental health care, where a space is created for youth to explore their identity, discern how they know what they know, what wisdom they already have about where they want to see changes, what needs they have coming up, and then also bringing education on what resources and options are out there. working with kids and their families on communication with one another, on how to meet the kids' needs, and also just providing a space for safe exploration and planning for safety outside of the therapy room as well. There's a lot of really great statistics out there about what gender-affirming care does for people. I don't have it with me, and I'm not great at statistics, but there is some early information on the 2022 U.S. Transgender survey that just speaks volumes. It's a lot about the statistics really show what trans and non-binary people have been saying forever about how great gender-affirming care is, and continuing to go back to believing people when they say who they are and what they need. But there's really lovely stuff out there that's getting more and more easy to find, and I feel really encouraged by that resource and what we'll continue doing.
Thank you so much. Dr. Gedin, these next two questions are for you. We know that finding inclusive providers can be difficult. What are some resources you can share to help navigate this challenge, and what rights people have should they have a bad experience with a provider?
I think starting out with your provider and who's providing your care is totally up to you, right? People sometimes, there's a power imbalance in medical care. You're listening, we're an expert, we're telling you, but you're an expert on you, right? And so acknowledging that, and if somebody makes you feel uncomfortable, if someone is not listening, if someone is being dismissive, asking for a new provider, right? Whether it be in that practice or looking elsewhere. And that can be a daunting task to say, okay, I'm looking for X, Y, and Z in a so many mile radius of my home. That's not always an easy thing to do. But I think it's important that people know that you don't have to accept whatever treatment you're getting. And you do have a right to things like gender-affirming care. So if your provider is being dismissive of that, or it's not something that they offer, also recommend calling around, right? Just asking, I'm looking for a provider that offers this. Is there anyone in your office that does that? You'll find out pretty quickly, right, if they know what you're talking about. If they don't, then it's probably not the place for you. But those are the types of things that I would really recommend. And then understanding your rights to your records. That your health record is a legal document, it is yours, and so if providers are refusing to do something or are being dismissive, ask them, I'd like this noted in my chart, right? I know there's a lot that comes along with, depending on the type of care that you're receiving, with insurance companies, and making sure that things are documented appropriately so you can start a process is a long journey for any number of things. And so making sure that what you are saying is being appropriately documented, asking for those records, they belong to you, we'll print them off, they'll give them to you so you know what's in there, what's being said. All of those things I think are really important. And then looking for sites, I think particularly for youth, that offer more than one thing, right? Looking for sites that are offering a team-based care approach. That's really important because the healthcare system, we do an awful job of communicating with one another. So your therapist and your primary care provider and your social worker, we're all in different places. Oftentimes we're trying to get notes and read, and maybe we'll have a conversation, but it can be really difficult. And so making sure that telling your story can also be really hard to do. So how many times do you have to tell it, and how many different types of ways? But if you have, or going to a practice that offers true team-based care can be really, really helpful, that they are rounding about you, or talking about what your needs are, understanding that and sharing information is critical when you're looking at choosing a provider. I think we've shared a lot of the good resources in the county, but happy to do that again, and how you go about finding those just to make sure you get the care that you're looking for. And there's another part to that question. What should you do if you have a bad experience with a provider? It depends on how bad the experience is. Everybody has a board, right? That's one thing. So if you truly feel like you've had an experience where you were disrespected, the provider was inappropriate, you can report them to the licensing board. That's one way. I think otherwise, if you're looking to just find another practice and move away from a provider that you feel just isn't a good fit, but also knowing that you may have to try a few different providers on to find the right fit, and then not being shy about hiring a provider. And that means your medical provider, your therapist, you may have to try a few on until you find the right person for you. And it's hard to do, but I think once you've found the right place, the right medical home, it's really worth it to keep trying to find someone that you feel really comfortable having open and honest conversations with, because that bidirectional information sharing is critical to everything that's happening. Otherwise, you're getting really generalized care, and it's like, okay, generally for people this age, this gender, this is what we're going to do. And that may not work for you. And so you have to be as open and honest as you can be, and that can be difficult.
Thank you so much. And then the next question, as we were preparing for this panel, you discussed the importance of sharing sex assigned at birth with their care providers. Can you expand on the reason this is so important, acknowledging that it can be hard to share this conversation if there is not a safe provider?
Certainly. So when I was working at Healthcare for the Homeless in Baltimore, we were, it's been a good little while now, maybe 8-9 years ago, providing transgender care, gender affirming care in the clinic. And we were seeing a good number of people, and sometimes we would find out we've maybe been seeing someone for 6 months to a year, and we didn't know their gender assigned at birth. And why is that tricky, and what does that mean? There's a couple different things. There are screenings and testing and things that are recommended based on anatomy. And we still need to make sure that we're doing those things. Also, if you are taking hormones or if you're on various treatments, your provider needs to know that for interactions with other medications and what are the side effects and how are you doing. So even if that provider is not the provider prescribing those medications, it's still really important that you share that information. And that's difficult for folks, right? Having those sorts of exams, going through certain treatments is really hard, and that's why I think it's important to find the right providers, but making sure that you are getting things and screenings done that could be life-saving is still really important to do. And so figuring out if you've got a provider who can actually document all of the above in your chart, right? So this is their gender identity, this was their gender assigned at birth. Those sorts of things are important to make sure that you're getting everything that you need from your healthcare provider. And so I think some of it was changing the way that we asked questions, right? We started screening people, and so when you came in, it was something we asked of everyone. It didn't matter how you presented, what we thought of you beforehand, how long you'd been a client with us. We started screening for sexual orientation and gender identity. Every client, so then you could really fill out your chart and have a full understanding of who you are and what sort of things we should be providing as a part of your treatment plan. And again, every provider's not there yet, but it's important that you have those conversations to make sure that you are getting appropriately treated no matter what it is.
Thank you all so much for discussing just offering information about the access to gender affirming care and being able to hold your medical providers accountable. And as we talk about physical health on a broader scale, I want to kind of rein it in also to some of the barriers that exist in areas that we often take for granted. Youth don't always have a home to sleep in comfortably. There might be yelling, there might be, experiencing homelessness, so they don't always have access to get the restful sleep that they need to participate during the school day. Not all youth have access to nutritious meals, and so food scarcity is still a big issue in the United States, and it is something that is still experienced amongst youth within the Arundel County area. Working for the Housing Authority, I worked with them during COVID, during virtual learning, and oftentimes needing to prioritize whether a kid eats, whether a kid does their homework, or sometimes just lays their head down on the desk to get a nap in the middle of the day. It was a lot to make those tough choices and be the one to decide what is in the best in this moment, and having to prioritize seeing that they could potentially fall behind if I do let them lay their head down, or knowing what their home situation is like. They're not always getting the support, the care, the safety that they need at home. Being able to make space for that. You don't have to be a healthcare provider or a therapist to be a safe space. You're a teacher, school counselors, mentors, advocates. All of us have a role in being able to provide a safer space for youth within our community. And sometimes it just takes a listening ear or being able to offer the support that they might need. So as we transition into physical safety, our first question is for Captain Miguez. We know hate crimes are on the rise for the LGBTQIA plus community. Can you share what rises to the level of a hate crime and how to report instances to the correct authorities?
Yes, so first of all, there's a difference between a hate crime and a hate incident, and both can be reported. A hate crime is a crime that is a crime regardless of whether there was a hate factor involved. So if you have a theft, but the person who stole the item also used a racial slur or some other derogatory term, that would add that hate crime part to that crime, the hate part. So there's a lot of terrible things that people say that aren't hate crimes, but they are hate incidents. And those can be reported, like I said, just like a crime could be reported. They get reported to us at the Annapolis Police Department and Arundel County Police Department. And there's a lot of different ways for us to handle them. A report is taken, but it's really about the support that you receive from talking with the officer, from the follow-ups. So I'm the LGBTQ liaison for the city. The county also has Corporal Stanley. She is their LGBTQ liaison. And we read all of the reports that come in that have any touch on any of the LGBTQ community. And part of what we do is we reach out to the officers and we reach out to the victims to see if there's anything else that we can do, whether it's a hate crime or a hate incident. Now, there's a lot of stuff that goes unreported. My child is a member of the community in high school, and there's been some really hateful things, said to them. And we haven't reported it. We don't know who the kids were that were shouting the things at them. We certainly could, but there's a lot of stuff that happens that go unreported. So when you have something happen to you and you believe that there's a hate aspect to it, that should be something that you're telling when you're reporting that crime. Not every officer is a member of the community, though some are. And not every officer is familiar with the community. They do receive training on gender diversity, on the community, things like that. We get trained on so many different things. But we aren't always going to make a leap. If you've been the victim of a crime and we think you might be a member of the community, we're not going to necessarily see that right away as an indicator that you might have been targeted for that, unless it's something that you bring up and that you feel. I think a lot of times when something bad happens, the victim, the person who it happened to, has a lot of thoughts going on in their head. It's so much an adrenaline, an emotional thing that has happened, but it's really important to talk about what you're thinking, when you're making that report. Because it will become a story about a crime that was reported and how you think you were targeted and the police didn't do anything. So it's really important that if you feel that way, that you make sure that you verbalize it. Our officers are getting better at asking those questions, but it's not always a question that's easy to ask, especially if you're not sure that the victim is a member of the LGBTQ community. We don't like making assumptions about people, and some people get upset about that. So I really would urge you, if something does happen, that you do mention it, that you believe that might be a reason why it happened. I think, like I said, a lot of things go unreported, but one of the things that can happen in these hate incidents that don't rise to the level of hate crime, a lot of times we see things being reported between people who know each other, neighbors, or maybe people who work together, and those things can escalate. And so if you're reporting it, it may help things settle down. Officers normally will try to do some sort of conflict resolution. In this case, it's hard to cure the hate in someone's heart, but it's not always the case that it is hate. It can also be misunderstanding. We're not all as educated about the community, and we have a lot of upbringing that you might have that leads you to make judgments about the community. So it really pays to call, and certainly if it's a crime that's happening right now, you should call 911. But I also have our non-emergency number on some magnets in the back. It's just important that you take the time to report it. We're all busy, we all like to go on to the next thing. Maybe it's happened to you before and you haven't done anything. But it's important to hold people accountable for the things they do. And as progressive as Maryland likes to think it is a lot, there's still a lot of room for growth.
Thank you so much, and thank you for sharing so candidly. You know, as we discuss physical safety, I also want to raise some awareness also to hate speech that is still very prominent in public schools, and that can also threaten and just destabilize the sense of physical safety that an LGBTQIA youth may experience in their schools. I know in working with the youth that I did, there were plenty of microaggressions, and hate speech was used almost casually, and it was in their everyday speech. And while we cannot reprimand them and we can't hold it against them due to education and their background, we can also provide education, which is why I'm glad that this is being recorded and this can be shared amongst all of our communities and all of our circles. How can young people remain safe in public places, and what are the real risks and real possibilities for young people in public places? Captain Miguez.
Well, I'd like to give people, a silver bullet about how to stay safe, but there's so many factors involved. And for LGBTQ plus youth, unfortunately, the rates of violent victimization are very high compared to heterosexual youth. So that's really something to educate yourself about, to know that even just knowing that can help. There's being safe in public places, but they're also at risk in private places with their family, with social peers, like you said, in school. People being threatened. They're actually even at a higher rate of risk of dating violence. So unfortunately, there's no breaks. There's really no breaks for the community. A lot of things being physically abused by a parent or another adult in their house, their rate's 20% compared to heterosexual 10%. So it's really important for people to be aware. If you have a kid in your life who's a member of the community, just be aware that that's putting them at higher risk. Keep that in mind. Identifying safe spaces. We talked about safe spaces before. That's a great place for kids to be, whether it's going to a PFLAG meeting, a GSA meeting. But I've gone to GSA meetings at Annapolis High, and there are kids that don't go to those because they don't feel safe even going to the GSA meeting, being identified as a kid who goes to the GSA meeting. So that can be hard to find a safe space within your community. Being with a group, finding your people. I mean, that's kind of what we talked about at the beginning with Katie. You know, sometimes you don't have your people yet. So trying to find those people. When you're out and about, you know, going with someone, having someone know where you're going, when you're going to be back, keeping in touch with. There's just basic safety things that people can do that most people don't think about, you know? And it's helpful for people for anyone to think about them, not just LGBTQ youth, but it's unfortunate that they're victimized at higher rates. Now, like I said, Maryland, you know, we like to think of ourselves as very progressive, and we do score very highly on a lot of the nationwide comparisons when you look at other states. So we are lucky in some ways. In fact, the Trevor Project rating for Maryland said that 74% of the community felt that they were very or somewhat accepted. So we have that going for us. But we generally really need to work on those other areas. When you were talking about behavior in schools, you know, it's hard to regulate, but it is pervasive in our schools, and the kids in our community don't feel comfortable being themselves in school.
Thank you so much. Thank you. Like you said, we like to think of Maryland as a safe blue state, but there are so many pockets that are not safe for everybody, and they are not inclusive of everybody, and that's why it is so important, especially as we enter an election year, to be loud about what we support and who we support, and be open about the communities that we are standing for, because there are people who are actively fighting against us, who are actively working to dismantle so many of the protections that we are working towards creating. And so it's important as a community to also acknowledge that physical safety completely ties in with physical health and mental health. If an individual is not feeling physically safe, if they are not able to get the protection that they need, that impacts physical health, which also impacts mental health. It's all a ripple effect that works together, and it can be hard. Which one do you combat first? Which one is most important? It's just showing up and letting that youth know that you are there for them, that you support them, and that you love them. I'm grateful that we as a society, I think, are moving away from sticks and stones may break my bones, but words will never hurt. Because words are so harmful, and words are something that we can't always see or hold in our hands, but they become internalized, and they are the thing that stick with us for the rest of our lives. And it takes sometimes therapy, it takes having a support system to unpack and unlearn that those words are not always true. And so again, as a community, it's important for us to band together and support youth and protecting them physically, mentally, and offering them a safe space. Our last two questions are for Smith. The first one is, some households are not accepting of LGBTQIA plus youth. Can you discuss why some youth may be concerned about coming out at home and the potential violence facing them?
I feel like a lot of this we've kind of covered with a lot of these last few questions. But the concerns that kids have and coming out at home, they really range. And the range is broad. They range from being concerned that parents will worry about them, that they'll hear a coming out as a concerning thing. being concerned for your kid, not necessarily entirely bad, but it's also not necessarily what a kid wants to have as the way they're coming out is received. They might be worried that parents will be disappointed, families will be disappointed, or feel less aligned, less connected to them emotionally. They might not see them the same way anymore. And this applies to home, but it also applies to school. It applies to peers and siblings and cousins. And then it ranges all the way to, like we talked about, worrying about physical violence, worrying about losing food, losing shelter, and experiencing being ostracized from family, from home, and from communities. Those communities that immediately surround us, the sets of people we are always around. And further violence can then be experienced when we begin to use substances, engage in self-harm, take other risks as measures to protect and numb themselves from the violence of rejection from family, community, emotionally, physically, psychologically, and spiritually.
Thank you. And then we also know that if LGBTQIA plus youth do not have supporting homes, it becomes even more important for them to have safe spaces at school. How can teachers, administrators, and school staff start providing a more welcoming environment in schools?
Teachers, staff, administration can be that adult for students. If they don't have those people at home, the adults who reflect back to them that they can trust themselves in knowing who they are. They can trust themselves when something's not right, and there's something that's coming out that they're needing. When students talk about other unsupportive interactions with other teachers and staff, taking that seriously, not just an empathetic ear is so important, but it's also incredibly important to follow up with those colleagues. And if that right person to follow up with that colleague isn't you, considering who that could be, to have the kind of conversation where they're encouraged to learn and do better. And then kind of going back to this idea that queer people, queer youth, know who they are. So remember that queer students know what they're talking about. I can often hear just anecdotally from people that I work with that they'll say something to a teacher, and the teacher will then explain to them what they're talking about, which I think it must be hard to do in that role because you are teaching all day. And I think maybe just upon humility and curiosity and learning that is expected and encouraged in students to when you are listening to them.
Thank you, and thank you all so much for taking time out of your evenings to be here with us. You know, as we close out and just thinking about how impactful it is for all of you again to spend your evening here showing up and showing support for LGBTQIA plus youth, what does it look like for you all to show up as you leave today? You know, all of us have different aspects of our identity that are of privilege, and there are aspects of our identity that are of marginalized background, whether visible or invisible, and things that people know, things that people don't know. And so showing up looks very different for all of us, but all of us can make an impact. And it can be one person that reaches out to a youth and says, hey, why don't you, have a friend group over, or I want to help lead a GSA, or I want to provide gender affirming care and make that more visible within my practice or within the spaces that I work in. You know, all of us have a role to play in being able to provide safe spaces for LGBTQIA plus youth. In the same space that we can hold love for one another, we can also hold one another accountable with love as well. Again, thank you all for spending your evening here, and please give a round of applause to our wonderful panelists tonight. Does anyone have any questions for our panelists?
I have a list, so can I get that? It's a short list. That's enough still. Okay, referring to the question from earlier about calling for help, what do you do when you know that the friend or person's parents or guardians will be angry and potentially take action against the child?
I think that is such a hard position to be in. And I don't think that there's any one answer that's correct. I think it's also situation specific. And I think that's probably the most annoying answer to start with. But there are many things that can be done. And thinking about, with the person that you're concerned about, who do they have in their network of people? If you're concerned about a reaction at home that's serious, and it's important that you know that and that you recognize that. Sometimes there is a guidance counselor at school who you can talk to. Sometimes there's not, and that's a reality. Do they have a therapist they're already working with? Do you know of a therapist who works with young people? It's important to know that access to mental health care is open to anyone. Someone who is 12 years old and older can consent for mental health care as well as substance use care on their own. There's complications because that care needs to be paid for, right? But like, there are things that can happen. There are people that you can reach out to. And there are resources like pro bono counseling projects. There are Jazzmyn, I brought something too. There are resources for therapy and access to care that young people can be connected to without going through adults if there's adult services.
Thank you very much. Yeah, I do. Okay. The next one was, can anyone get certified to be a mental health first aid or emergency responder? And if so, how would you do that?
So actually, Mental Health First Aid has a website. If you search Mental Health First Aid, they do a number of different types of mental health first aid. And so we do the one for law enforcement, but they have ones for paramedics, and they have, I think, ones just for general public. I don't know that they offer them all online, but they do have classes listed there where they're available.
Thank you so much.
Also, if you're interested in that in person, the mental health agency offers mental health first aid training, and there's one specifically for adults and youth. So there are two different trainings that people can sign up for, but they do offer them in person. We're starting in the mental health department. You might be able to get on the top of my head. But that's one issue. We prefer to do it in person.
Thank you very much. Is that it? Okay.
I wanted to follow up on your first question. And Smith, as you were talking, I was trying to think about a condensed way, but there are so many complications to wondering about the safety of a youth when they are coming out. And so my biggest piece of advice for you is being able to identify a safe adult, and knowing that as a young person, you can be supported and you do deserve to be supported, and ensuring that that safe adult follows up with that child so that if they are in a dangerous situation, then that adult can do the necessary protocols that are necessary so that the child can be safe and they can get the necessary help that they need.
Thank you.
Thank you all very much. Tony mentioned that one of the challenges might be that providers may not know what they need to know, or they may not know what they don't know. when you're going, but maybe this question could apply also to all the panelists, whether you're a medical provider or a mental health provider or a first responder, is what resources or organizations are there to provide formal training or continuing education so that personnel in these roles know how to properly serve the LGBTQ community, and are there opportunities for Annapolis Pride or the health department or the city to partner with them to bring that type of training to Annapolis and Arundel County?
Oh, you go, okay.
So one resource that I am aware of is safe zone trainings. It's something that someone can get a certificate in facilitating it, and it can be led by any person who is trained in that safe zone training. And so essentially it is being able to offer resources in terms of education on pronouns, educations on hotlines, and they have them at the university level, but they also have them at high school, middle school, elementary school level. And then individuals who participate in safe zone trainings get a nice sticker that they're able to put on their door, and so they can be identified as a safe, like a specific safe space that has gone through the safe zone training.
I was just going to add that I know there are a number of therapists in our local-ish area that are people of lived experience who do a lot of consulting and will work kind of longer term with agencies if the agency is actually genuinely up for it, to do training and looking at health records, reformatting things, how do you go beyond just putting some drop downs in your health record, and actually make a kind of system-wide recognition of the training that you're doing. So there are those resources out there.
I mentioned earlier Chase Brexton, but they also provide trainings through their LGBTQ Health Equity Center. So if you're a provider and you don't really know where to start, or you don't know what you don't know, they're an excellent resource. Also, the Center for Transgender and Gender Expansive Health at Hopkins, they do a lot of good work if you're looking to learn a bit more about, a little bit of everything, and where to start, and what are the things you should be instituting in your practice from the front door, right? It starts there. It's not just once people are actually in the exam room, it's all of the staff. So whether you have a license or not, how are you talking to people? How are you asking about insurance? How are you asking about gender? How are you asking about sexual orientation, and how do you do it in a way that makes people comfortable? And if they're not, how are you okay kind of stepping back from that and accepting what their answers are?
And the training we get, we have a lot of training on multiple different communities that we serve. So there's a lot of stuff out there. I mean, whether it's autism, awareness, different communities, cultural differences, we're constantly getting trained on those. So gender diversity and the community, we actually did, Corporal Stanley and I did the in-service training this last year for the officers. We did the panel for Annapolis Pride last year. I think it was in May or June. I don't know if you were able to video that. But we do that training. We've had other groups come in and do training. We've also reached out to Annapolis Pride. That wasn't something that we had resources for at the time when we were doing our last training, but we're certainly open to getting outside groups in as well. One of the things that we emphasize in training is that this is awareness and also expectation of behavior, and both our county police and our city police departments wear body-worn cameras. That cops are just a general segment of the total population, so there's going to be some that don't understand the community or have different religious beliefs or what have you, that have different feelings about the community, but our bottom line is that they need to treat everyone with respect, and they've been trained and they're wearing cameras, so that's the behavior that we expect. So we got a lot of good feedback from the officers. There's a lot of officers that are members of the community, so we both have very diverse police departments, but can't police people's thoughts. So all we can do is, based on their behavior, make sure that they behave correctly.
Thank you so much. And then I want to highlight 2 additional resources. The Center for Gender and Intimacy have 2 locations located in Frederick, Maryland, and then there's also a physical location in Ellicott City. They have plenty of therapists, and the founder they work with gender expansive populations, and they would be able to facilitate trainings. I also have a flyer for the neighborhood training clinic. While the physical location is located in Frederick, Maryland, the therapists service all of Maryland through telehealth. It is a free service. We do not go through insurance. We see kids as young as 16, adults, elders, couples. There are no limits to the sessions. And it's a free resource, so if anyone is interested in sharing this resource, I have the flyer as well as the business card to the clinic director, Dr. Stephanie Snyder, who is wonderful in overseeing the clinic, and there are plenty of individuals and counseling interns there who would be happy to offer psychoeducation groups and any opportunity to better support LGBTQIA plus youth.
Any other questions?
So to piggyback on what my son said, because I know exactly what he was talking about, what can I do as a mom when your kid comes to you and tells you their non-binary friend is telling them they have suicidal thoughts, and they also have told me just things about the family dynamics. I mean, if anything happened, I'd be devastated. Do I please turn on the parents? I don't know what to do in that situation. Thank you. Anything?
That is hard.
Yeah, totally.
And I think the first thing that you're already doing is supporting your kid. And I see this a lot with kids that I work with, where they have these relationships with other peers that don't have the kind of support that they have. And that is a lot. I think that's important to speak to when kids, teens are holding that space that other children don't have in adults. It's more than should be expected. And so then supporting your son, being there for conversation, and making sure that that kid has access to numbers, like the Trevor Project's line. There are texts. I know we've shared a lot. They also have some papers in the back that have some actual phone numbers and the numbers that you can text rather than call. A lot of these websites also have a quick escape button on them in case a parent would have a bad reaction to finding their child on a support site, and continuing to see if you can establish a safe person in that kid's life who can provide additional help, so that child has an adult to talk to. And as much as peers are wonderful and it's vital, to not have peers is not okay, but having an adult is really important for all of them.
Okay, great.
Yeah, no, that's very difficult. And I think all the suggestions that Smith had were very valid. I mean, encouraging the child to reach out to someone if their family is not supportive, another adult that can provide some extra support. You know, the consent for being 12 and up, you know, the possibility of being able to get into some sort of counseling without their parental consent. But, you know, it's something you have to monitor, because if it comes down to it, you might have to make that call. And like I said, the consequences could be bad to get through, but could be important for that kid.
Thank you.
Just one more, and this is on the paper in the back as well. There's Trans Lifeline, and so it's not one of these services that's offered 24/7. A lot of them are 24/7. This has a more limited set of hours. That's another resource too, and it's for trans people by trans people, and so that is an opportunity to have a trained and person, another adult who somebody could call to speak to, who has some lived experience as well.
Thank you.
Any other questions from anyone? Okay, well, I want to thank all of the panelists again for being here tonight. I know that they're all going to be here for a little bit longer if you have individual questions you want to ask. We have plenty of food in the back, so grab some food before you leave. There's a bunch of resources in the back, so Molly's sitting back there, who helps run PFLAG in Annapolis and Arundel County. They're a co-sponsor of this event along with the library, so we're really glad to be here. The last thing I wanted to say is that I do want to thank everybody for being here tonight. I grew up in Pasadena, Maryland, not too far from here. I did not have a super supportive family, and so the work that we do here at Annapolis Pride is part of that. Like, I want to make sure that there is nobody who does not feel safe in their home and in their community. And so I'm really proud of the work that we're doing with Annapolis Pride. Thank you to everybody who's on our advisory committee as well. And our parade and festival is on June 1st of this year, so save the date. It's the first day of Pride Month. Everybody here is invited. We'd love to have you come out. It's going to be a great time. It's going to look a little bit different this year if you've been at the parade and festival the last couple of years. But it's going to be really exciting. So thank you all for coming. Please connect with us for resources, and I hope everyone has a good night. Thank you.
Thank you.